Okay, why did you choose this site? During my LPN year, I had the opportunity to observe a C-section during one of our clinical rotations. And ever since then, I've had a great interest in knowing and learning exactly what the role of the RN nurse is in the OR. During our RN year, we haven't had a lot of experience towards the OR or any surgical service, so I thought this would have been a great opportunity for me to know exactly what the role of the RN nurse is. Uh, what are the Did the experience meet your expectations? Yes, definitely. I think that this experience definitely met my expectations just because going into OR and surgical services, I had a minimal knowledge of what the OR nurses did. And throughout this experience, I was able to learn and gain a lot of knowledge towards exactly what the role of the circulating nurses, the scrub nurse, and the pre-op nurses, and also the post-op nurses. What are the pros and cons to working there? So some of the pros of working in surgical services include the environment. So when you go into the surgical services area, you are like in your own environment. You go in there and you have your own surgical scrubs that you need to wear, and you know exactly what you're going to be, who you're going to be working with that day, the team you're going to be with, and you know exactly what you're going to be doing. Also, the hours are great. They work from 7 to 3:30 in the afternoon, about 5 days a week. They don't work weekends. So anyone that is looking forward to hours, to 8-hour shifts and having afternoons off, I think would be definitely a good place to work in. Also, many of the nurses in surgical services or in the OR get the opportunity to float from different areas, including the pre-op, post-op, and also the OR. Anyone that likes change, anyone that really likes to see different things every single day, this would be a great place for them to work because every day is different. You can also have, like I said, have the opportunity to float from different areas throughout the time, and in OR you see different surgeries almost every single day. Some of the cons include, like I said before, the hours, although they are great, you also are on call once a week and also every 6th weekend. So if you're that person that doesn't like to be surprised with a phone call at 10 p.m. at night, that you need to go into for surgery, then I don't think this would be a good fit. Also, like I said, they work about every 6th weekend, Friday through Sunday, I believe, and they're on call during these times, and you have to be from a certain parameter from the hospital when you are on call. So I believe that would be one of the cons to working in surgical services or the OR. Do you now have a personal interest in working there? Personally, at the moment, I do not, just because I am going to be a new nurse graduate, and I believe that I want to first work and learn my nursing skills, get them all kind of down, learning new IVs, how to start IVs, working with the IV pumps, chest tubes, etc. I kind of want to get the feel of the basic nursing first, like for example med-surg. But in the future, I really would enjoy working in surgical services or in the OR, just because, like I said before, the hours are good and you learn so much. There's just so much to learn in OR, and I really like being in different environments. So working in pre-op, post-op, and also OR, to me that would be definitely a good thing. What are your recommendations to anyone else thinking of choosing this site? So anyone that is interested in surgical services such as pre-op, post-op, or OR, I would definitely recommend this preceptor site, just because as soon as I started my first day, everybody was very welcoming, the staff was very helpful. Every day everyone did their best to teach me as much as they possibly could from the surgeries or any procedure that was being done. I learned a lot from not just the nurses, but also the surgical techs, the doctors, and everyone. all of the entire staff. I've learned a little bit from every single person. They did their best to get me into all the surgeries they could, see something new. I also enjoy the fact that I was able to be in pre-op. I got to start a lot of IVs. Before this experience, I didn't have a lot of practice and experience with the IVs. And in pre-op, you do IVs on almost every single patient. So that to me was a very helpful experience to get the feel of starting the IVs. And the nurses were really nice at helping me out when I began in the beginning. And also, I got a lot of the nursing skills down in a lot of nursing skills. I became more familiar with them in pre-op and also in post-op. I was able to see the recovery of many patients from general anesthesia to nurse sedation, which was very interesting to see. I was able to watch their vital signs until they were stable, or give them what they need, intervene as possible. Also was able to help many of the nurses with discharge teaching. I was able to give the patients instructions on any teaching that needed to be done as they were being discharged. And in conclusion, this was a great experience. I recommend it to any nursing student that is interested in surgical services.